really excited to be discussing with you today the results of the phase 3 RASolute-302 study. Now, this is an incredibly exciting clinical trial. Many of you may have already heard a bit about daraxonrasib, which is really a novel agent. It's an oral RAS-on multi-selective tri-complex inhibitor of RAS. And this seems to have significant activity that's been documented already in pancreatic cancer. This affords us the opportunity to look at the drug in a randomized phase 3 clinical trial. Now, this study evaluated patients in a one-to-one fashion to receive either daraxonrasib or the investigator's choice of standard of care chemotherapy. In total, about 500 patients were randomized, and what we saw here is a statistically significant and clinically meaningful improvement in both overall survival and progression-free survival. What we saw in this study, for instance, was a median overall survival in the overall population of 13.2 months with daraxonrasib versus 6.7 months with chemo. This equates to a hazard ratio of 0.4. Progression-free survival also in the population at large was 7.2 months versus 3.6 months in the control arm. Now, this is really remarkable because the data is not so dissimilar if you really ferret out those patients who have RAS G12 alterations. So what I would argue here is that I think this represents, I would say, an unprecedented paradigm shift in how we're treating advanced pancreatic cancer in patients either with or even without RAS alteration. The drug was reasonably well tolerated. Certainly, there's some rash associated with the agent that one needs to be mindful of, as well as stomatitis. But otherwise, it's exciting to see a non-chemotherapy option for patients with second-line metastatic pancreatic cancer.